Let's get straight to the point. Number 8. The willow bark chew. Imagine having a splitting headache so bad you can't see straight, and your only option is to literally gnaw on a tree like a desperate beaver with a migraine. Before we had bottles of Advil in every purse and glove compartment, ancient Sumerians, Egyptians, and Native Americans were stripping bark off willow trees and chewing it like some kind of woodland psychopath. They weren't just hungry or confused about what constitutes a meal. They were actually performing organic chemistry with their molars. It sounds like the kind of hippie nonsense you'd hear at a farmer's market from someone wearing too much hemp, but willow bark contains salicin, a compound that your body converts into salicylic acid. That's the exact same active ingredient in aspirin, just without the coating and childproof cap. Basically, the bark breaks down inflammation, reduces fever, and kills pain by blocking the enzymes that tell your body to hurt. It's like a pharmaceutical factory growing on a riverbank. Today, we pay $15 for a bottle of Bayer aspirin that was literally synthesized from this exact tree bark in 1897. Big Pharma just extracted the chemical, added some buffering agents, and slapped a premium price tag on it. Meanwhile, your ancestors were getting the same relief for free by walking outside and finding the nearest weeping willow. It turns out that sometimes the best pharmacy doesn't have fluorescent lighting and judgy pharmacists. It's just got roots and a decent root system. Number 7. The honey wound dressing. Look, nobody wants to pour their breakfast condiment into an open gash. But for ancient Egyptians, Greeks, and Romans, that jar of honey wasn't just for tea and toast. It was the go-to emergency room supply for battle wounds and surgical cuts. If you got sliced by a gladiator's sword, the medic wouldn't reach for sterile gauze. They'd slather you in sticky golden bee vomit and call it advanced medicine. It sounds like a recipe for attracting every ant and fly within a 5-mile radius. But honey is actually one of nature's most powerful antimicrobial substances. Here's the thing. Honey has extremely low water content and high acidity, which creates an environment where bacteria literally can't survive. It also naturally produces hydrogen peroxide through an enzyme called glucose oxidase. Basically, it's a slow-release disinfectant that keeps working for days. On top of that, honey creates a protective barrier that keeps the wound moist while simultaneously debriding dead tissue. It's like having a tiny janitor cleaning your injury around the clock. Today, modern hospitals use medical-grade Manuka honey dressings for diabetic ulcers, surgical wounds, and antibiotic-resistant infections, charging $30 per bandage. The FDA has approved multiple honey-based wound care products. Meanwhile, Cleopatra was already using the same stuff on her skin while building pyramids and dodging assassins. It turns out that sometimes the best medicine is just what bears have been raiding for millions of years. Number 6. The leech therapy. If you think modern healthcare is a blood-sucking scam, wait until you hear about actual blood-sucking as healthcare. For thousands of years across Europe and Asia, doctors would deliberately attach parasitic worms to your body and let them feast on your blood like tiny vampires at an all-you-can-eat buffet. It sounds like medieval torture or a really bad dating experience, but these slimy little creatures were the Swiss Army knives of ancient medicine. Medical leeches secrete over 100 bioactive substances in their saliva, including hirudin, a powerful natural anticoagulant that prevents blood clots. They also inject anesthetics so you don't feel the bite, and vasodilators that increase blood flow to the area. Essentially, they're mobile pharmacies with teeth that improve circulation, reduce swelling, and prevent tissue death after surgeries. Today, the FDA officially approved leeches as medical devices in 2004 for microsurgery and reconstructive procedures. Plastic surgeons use them to save reattached fingers, ears, and skin grafts by draining pooled blood and restoring circulation when modern techniques fail. Hospitals literally order them from specialized leech farms and bill your insurance hundreds of dollars per worm. While you're grossed out by the idea, your ancestors were already getting the same vascular therapy for the cost of a walk to the nearest pond. It turns out that sometimes the best surgeon has no medical degree, no opposable thumbs, and a serious craving for type O negative. Number 5. The garlic crush. Ancient Babylonians and Chinese healers treated infections with the same ingredient that ruins your breath on a first date. For wounds or respiratory infections, they'd hand you crushed garlic. It sounds like grandmother's folk remedy, but there's legitimate biochemical warfare in that pungent bulb. Garlic contains allicin, which forms when you crush the clove. This natural antimicrobial attacks MRSA, E. coli, and even drug-resistant tuberculosis by disrupting bacterial cell membranes. Ancient armies rubbed garlic on battle wounds to prevent gangrene, and it worked. Today, pharmaceutical companies are desperately synthesizing garlic compounds into patentable drugs because antibiotic resistance is spiraling. Your ancestors already had nature's pharmacy for the price of a garden bulb. Sometimes the best medicine smells terrible, but keeps you alive. Number 4. The bitter bark cure. Imagine dying slowly from malaria, burning with fever and shaking so hard your teeth rattle, and your only hope is drinking a tea that tastes like Satan's bathwater. Long before we had anti-malarial pills, indigenous Quechua people in the Peruvian Andes were treating fever with the bark of the cinchona tree. Spanish colonizers watched local healers cure what they called ague using this bitter tree extract and thought it was witchcraft. They weren't practicing dark magic. They were just ahead of the pharmaceutical curve by about 400 years. The cinchona bark contains quinine, alkaloid compound that directly attacks the malaria parasite in your bloodstream. It interferes with the parasite's ability to break down hemoglobin, essentially starving it to death inside your red blood cells. By the 1600s, this Jesuit's bark was saving lives across Europe, and by the 1800s, quinine became one of the most important drugs in colonial expansion because it was the only thing keeping soldiers alive in tropical regions. Today, quinine is still used in modern anti-malarial medications, and tonic water contains trace amounts because British colonials mixed it with gin to make the medicine more tolerable. The WHO lists quinine on its essential medicines list. Pharmaceutical companies have made billions extracting and synthesizing variations of this compound. While we act like modern medicine conquered malaria, indigenous Peruvians were already curing it with tree bark while building Machu Picchu. Number 3. The fungus pharmacy. Imagine walking through a damp forest and thinking, you know what would cure my infection? Eating that slimy stuff growing on dead trees. Ancient Chinese healers and European herbalists were doing exactly that, harvesting specific fungi and applying them to wounds or brewing them into medicinal teas. It sounds like a poisoning waiting to happen, but these ancient mycologists were tapping into one of nature's most sophisticated chemical warfare systems. Fungi produce compounds specifically designed to kill competing bacteria. Penicillin from Penicillium, cephalosporins from Acremonium. Ancient healers didn't know the molecular structures, but they knew which mushrooms and molds stopped infections and which ones stopped your heart. They documented this knowledge in texts like the Chinese Compendium of Materia Medica from the 1500s. They were essentially running clinical trials in the woods. Today, over 50% of all FDA-approved antibiotics are derived from fungi. Penicillin alone has saved an estimated 200 million lives since 1942. We've just repackaged ancient fungus into pills that cost $500 per prescription. While you're paying a fortune for branded medications, your ancestors were getting the same molecular structures for free by knowing which moldy log to scrape. Number 2, the fasting reset. Ancient Greeks, Romans, and Islamic scholars prescribed deliberate fasting for digestive disorders, epilepsy, and mental illness. Hippocrates said to eat when you are sick is to feed your sickness. It sounds like dangerous cult behavior, but they were triggering profound metabolic changes. After 12 to 16 hours without food, your body shifts to ketosis and activates autophagy. Your cells literally eat damaged proteins and pathogens. It reduces inflammation, improves insulin sensitivity, and triggers stem cell regeneration. It's a system-wide reboot. Today, studies show fasting treats type 2 diabetes, reduces cancer risk, and potentially slows aging. Biohackers pay thousands for fasting retreats. Your ancestors got the same cellular benefits by not eating and saving money on groceries. Sometimes the most powerful medicine isn't something you take. It's something you don't. Number 1, acupuncture. For over 2,500 years, traditional Chinese medicine practitioners have been sticking thin needles into specific points on the body to treat pain, nausea, and hundreds of other conditions. It sounds like mystical nonsense. Just expensive placebo theater for people who believe in crystals. But here's where it gets interesting. Modern imaging technology has proven that acupuncture points correspond to concentrated areas of nerve endings and connective tissue. When you insert needles at these points, you're triggering measurable physiological responses, releasing endorphins, stimulating the vagus nerve, reducing inflammation markers, and changing brain activity patterns visible on fMRI scans. Studies show acupuncture is more effective than morphine for some types of chronic pain, and it works on animals who can't experience placebo effects. Today, the NIH and WHO recognize acupuncture as effective treatment for over 100 conditions. The US military uses battlefield acupuncture for combat injuries. Major hospitals have licensed acupuncturists on staff because the data proves it works. Modern science spent decades dismissing it as superstition, then had to awkwardly admit that ancient Chinese doctors mapped the nervous system's pressure points 2,000 years before Western medicine even knew nerves existed. Sometimes the best pain relief doesn't come in a pill bottle. It comes from admitting ancient healers knew things were only now sophisticated enough to measure. Seriously, next time you're dropping hundreds of dollars on prescription medications, just remember your ancestors achieved the same results cheaper with tree bark, bee spit, and strategic starvation. Modern medicine didn't invent healing. We just put it in plastic bottles and added a copay. If you liked this video, don't forget to like, share, and subscribe. Stay curious, and I'll see you in the next one.